Hello.
Hi.
Thanks for coming today.
Pleasure to be here.
So, talking about infertility is so taboo, right? What are your thoughts about that? Why do you think that is?
And infertility is a very private matter. I mean, fertility is intimately tied to sexuality, and we don't talk about our sex lives. But more than that, I think that infertility, as you said just a minute ago, people feel sort of broken. They feel damaged. We think of being able to have a child as a sort of measure of our wellness. And I think that when you can't have the child, when it doesn't work out, you feel damaged and broken. You feel like it might be a personal failure. You feel like some retribution for something you did in the past. People take on all this blame, and you don't want to talk about the things that you feel guilty about. Now, I think that a forum like this is very important to bring out these conversations and help people process this better. But I think it's natural. I think society doesn't talk about things that make us uncomfortable. And this is something that makes people feel very uncomfortable.
I spoke a lot about women. I was kind of speaking from a personal point of view, but it does seem like we do focus on women when we speak about infertility. What are your thoughts about that?
Well, women are the ones who carry children. Women are the ones who become pregnant. They're doing 2/3 of the work. And actually, more than that. Fertility is a dance. It's a dance between a couple, or maybe between a woman and a sperm donor, but it's still a dance, and it takes both to do the steps to make it work properly. The reason we're talking about women, or why I want to talk more about women tonight, is because the problems that men have, the problems that some disease problems like endometriosis, other problems that you might be born with, well, we can try to work with those. We can try to do workarounds in an IVF setting with the male factor. We can try to do surgery and medications to fix endometriosis. But the one thing that we can really all do about in our everyday lives is be aware that fertility changes over time, especially for women. For men, it changes over time as well, but not till you're my age. And so a woman begins to lose her fertility in her 30s. And that becomes very, very, very significant, especially when many couples are not even starting to try to have babies today until they're in their mid-30s. And you've already lost some ground there. I think that's why we have to focus on it, make people more aware of that as a continuing problem so they can. The biggest predictor we have of fertility problems is a woman's age. And everybody knows how old they are. So I think you can incorporate that into your planning and be able to be empowered to better plan your life.
Is there any way for young people to predict whether they'll have a fertility issue?
Well, we are actively working on that so that there are blood tests we can do that can tell us what your fertility is today, but also tells us where you are relative to your peers. And so if you know that some level is supposed to be here and you're down here already, while you might be quote unquote normal, you're already lower than you're supposed to be for your age. And I think that's going to be an important role in the future to empower women, empower couples to know where they stand and be able to plan when to have a family, when to pursue their career, and when to know they're choosing one over the other.
You know, there's such a, we both are very familiar with this field, and we see so many celebrities that are in their late 40s pregnant, and we look at that and we say, of course it was a donor egg. What are your thoughts about how that influences our culture? Should celebrities be disclosing that?
Well, I think celebrities have a right to privacy as the rest of us do. And I don't know that the celebrities called up the newspaper and said, hey, I'm pregnant, please come and photographed me. I think Kate Middleton would have been happy not to have people following her around through her whole pregnancy, and maybe Kim Kardashian enjoyed it, but most people are fairly private. I see celebrities as patients, and a lot of them don't become pregnant, and they're not in the newspaper. Celebrities have the same triumphs and failures as the rest of us. I think it's the media that has to give better balance when they do a story and recognize that it's simply not logically possible for somebody nearly in their 50s to have achieved pregnancy with their own eggs, and make us more aware of these realities.